Welcome, welcome. We're so glad you're here for this community of practice, Partnering for Promise, a collaborative community of practice to support BHSSA at Promise youth grantees. We are excited that you're here. We want you to feel resourced for the time we're spending together. And I know that many of us are moving quickly from one thing to another. So for the next minute, we're just going to give you time to do what you need to feel ready, settled, resourced for our time together. And then we're going to dive in for real. We are the BHSSA STAC. And as you probably already know, this is the collaborative initiative that is Center for Applied Research Solutions, the Commission for Behavioral Health, and the California School-Based Health Alliance to provide statewide technical assistance for all of you as you work through your projects. Another acronym that you will hear is TCT, which is our technical coaching team. And those are our 3 counties that are also BHSSA grantees who are here to provide peer training and counsel and technical assistance as well. So those are our acronym reminders. I'm Amy Blackshaw. I'm a TA specialist, and I'm also from the California School-Based Health Alliance, co-facilitating with our team here, Oriana Edis. And we have our TCT team that is from Imperial County. Irene Dyer, I know you're representing today, and you didn't get a chance to do an introduction last week. Do you want to come off mute and just say a little hello and intro?
Hi, everyone. My name is Irene Dry. I'm one of the BHSSA TCTs. I'm located at the Imperial County Office of Education, and one of my focus is to support you in partnership development, as well as any other technical support that you might need. I'm also, I have over 15 years working in education, but in the last 8 years, I have also worked as a mental health therapist. So happy to see all of you, and I hope we get to partner, and I'm here available to support you.
Thanks, Irene. You will get to hear more from Irene later as part of our peer spotlight today. And again, I apologize. I said your name again for the second time. Irene Dry. Okay, so our flow for today, we're having our welcome and orienting right now. We're going to spend a little bit of time defining our community of practice, creating shared language around seeing youth whole, which is our theme today, seeing youth whole, exploring ways of being and doing together in our work with At Promise Youth. We are going to have a peer spotlight, which this time will be our friends from Imperial County sharing with us their journey, and then integrating, looking ahead, and closing. Peer spotlighting is really an important part of our professional, our community of practice. As we mentioned last time, so much of the benefit of community of practice is really peer connections, peer sharing of your expertise, your challenges, ideas, resources, successes. And so I'm going to ask Stephen to drop into the chat the link so that we can have each of our counties sign up to do a peer spotlight in one of our upcoming sessions. It's really not a big lift. It's 7 to 10 minutes to just talk us through what you're doing, what are your challenges, where are you stuck, what are your successes. That's really what we've heard from you as a desire for this community of practice, is to hear about each other's work more deeply. So we want to make sure each county gets slotted into that peer spotlight schedule. So there it is in the chat. Please sign yourselves up. Today we're going to finish at 11:30, but we'll be available here in the space afterwards for anyone who wants to stay, wants to check in with us. We'd be happy to do that.
We have these community agreements. We'll bring them forward each time we gather, just as a way to kind of ground into this space, intentionally create the container for this space and how we want to show up. And so in this moment, I invite you to look at these kind of ways of being on the screen and imagine what they sound like and what they feel like and what they could create space for. But we're hoping that this can be a community that allows us to kind of regulate, drop into a space of wonder, be really honest around what we're grappling with and what we're needing. And I just really want to elevate how important relationship building and trust is for that to take place. So thank you. You know, it's really an important awareness to hold when we're designing programming and for us to consider who is in the room. And just importantly, as that, it's important for us to always be aware of whose voice and perspective and lived experience is not in the room. And so as we're creating a container for this community of practice, Amy and I wanted to uplift the experience of this particular young person. In the blue box on the screen is a poem that they wrote about their experience in school. And we want to invite into a chat conversation some of the strengths or qualities that you've seen in young people that might have been misunderstood or overlooked. And so we're going to take just a moment for you to identify a young person that you've worked with, who stayed with you in some way. And without naming them, describe a strength or quality you saw in them. Perseverance, drive, motivation, determination, resourcefulness, spirit, commitment, resilient, courageous. Thank you so much. It's powerful to see the strengths that you've witnessed in young people that you've worked with. And it's important that we acknowledge how so often in the spaces they navigate, those strengths are unrecognized or not considered in the programming we build. So as we move forward in building this COP together, can we carry these stories into our conversation today? That really is our hope. We want to spend a little time talking about what a community of practice is and why we value it as the way to support our work in kind of coordinating and connecting what it is we do. Right. So there are many, different platforms of ways of gathering that could have been possible for us. And in this moment, with all the challenges and possibilities that we're facing, that young people are facing, incredibly complex and more urgent than ever, we really did want to lean into the beautiful possibility of community and what it is we all have to bring to the table. So this is not just a space to share ideas, but really build our collective wisdom together through conversation, through inquiry, through lived experience, through bringing in resources, research, and tools. And so we wanted to share this visual here just for us to kind of all have the same kind of understanding around what this space is hoped to be. And again, I invite you to think about what it is you can bring to the conversation, to this community. If it is a space in which we're hoping to really uplift practice and support community and collaboration, the sharing of ideas, a space where we can collectively peer teach and learn, right? And so as you're looking at this visual and as you're thinking about how we are joined together in community to build something that strengthens our programming and the support we invite young people, just want to invite you to share in a conversation out loud. If you want to unmute or in the chat, what is one thing that you're holding right now within yourself that you think this community of practice can help you explore or strengthen? Thank you, Mel. How to support frontline service providers with impact. We know that so many of our frontline folks have lived experience, and that can be activating, right? That can wear on our spirit, that can come into the work and the way we provide or build relationship in a particular way. And so how do we hold that in mind as we're supporting our frontline staff? Thank you.
Hi, it's Janice Edwards. I'm with Alameda County also. I just wanted to just pop in real quick and just say how happy I am that Mel Rubio is here. She's our partner with Alameda County Office of Education with this grant. And it's just nice to be in a shared space with our partner in a larger group. So I get to learn from Mel throughout this conversation, because it's a different kind of conversation than the ones that maybe we've been having in our partnership interactions. And then I'll speak for myself. I also get to learn from the other counties as well. So it's just a really great opportunity to connect and learn, and also kind of consider things from all kinds of perspectives. I just wanted to thank you for making the space for us all.
Yeah, thank you. Thank you. I'm really excited about all of the opportunities that we have planned and will continue to build into our time together so that that can happen. I also see a desire for guidance and support to learn as we're building new programming. So thank you for sharing. And, hopefully as time progresses together, we'll find the words and we'll have a stronger sense of what this space can be for ourselves and for each other and for the young people we're supporting. So as we were, I want to share this. I'm not going to read this word for word. I think you have seen it already, but just want to share that we're in this second session, but the first official session. Last time we met, it was just kind of a welcome gathering. But we're in the first of 4 sessions, and depending on the needs that arise in our time together, we may offer additional sessions. Amy and I got really excited about having a panel discussion, having a working space where we bring a particular issue or piece of something that we're working on and grapple with it together. And so in addition to these 4 sessions here, the first, which we are on right now, we also may, based on what it is you all desire, provide more space and opportunity together as well. So our next session is in December. I think that's important to note. So quite a bit of time does pass, and we're thinking about how to create momentum and feel still connected to each other with the time that is in between our gatherings. So we want to kind of move into creating some space to explore ways in which we do and can see young people as whole beings. And we started already with bringing some of the strengths of our deeply cherished young people into the conversation. We're going to move into dyad conversations where we're allowed to bring our own kind of lived experience. And as we're making effort to truly see young people, how can we create space also, an opportunity to truly see ourselves as younger beings? So we're going to be invited into dyad in just a moment to explore who we were at a particular age. The invitation is to choose an age between 12 and 24. And think about in the next few moments who you were at that age, and particularly what you needed, what you deserved, and what you wished the adults in your life understood about you. So we're taking a quiet moment to identify that moment in our life, kind of connect to it, create space within us. we wanted to share this work. This is largely from the Politics of Trauma, Stacey Haynes' work, but this idea of wholeness, and that we all have this desire and need for safety, agency, dignity, and belonging. Right? And that promise cannot be actualized unless we are experiencing from our own perception, unless our young people are experiencing safety, agency, dignity, and belonging. So I just wanted to add this idea of wholeness to the conversation around At Promise Youth. Whereas At Promise really pushes back on the deficit mindset of at risk by recognizing potential and possibility. Wholeness reminds us that young people are full in this very moment, right? And it's not something that they must unlock in the future. They're already someone with wisdom, with voice, and with value today. Yeah, I'm just taking a look at the chat to see if anyone is sharing. Yeah, I see some appreciation around centering alongside young folks' wellness, provider wellness as well. Yeah, and so often we decide or determine for young people what they're experiencing, what they're needing. I see Michelle uplifting that, right? I'm going to hand it over to Amy, and she's going to support us in moving into another small group discussion.
Thanks, Ariana. Yeah, it really resonates for me to think about wholeness as this integration of a young person's experience to feeling safety, agency, dignity, and belonging. You know, it's helpful to think about them distinctly, but also together, and what that looks like to weave that together. So we want to invite you to back into some small groups to reflect on this framing of seeing youth whole and finding the connection to your work as At Promise grantees, as you're envisioning and planning and implementing programs. So these are our prompts. What would it look like or feel like if the systems around young people truly saw them as whole human beings? Where in your program do you see examples of seeing youth whole in action? And what kind of practices help your staff and program to see youth whole?
You know, we wanted to spend some time thinking about and being in discussion with one another about the tensions, right? And they already started to kind of surface in the chat as I was sharing, that to see young folks whole and to allow their wholeness into a space can often follow a completely different timeline than we're allowed, right? And it really requires its own set of skills. And so we wanted to spend some time in discussion thinking about, like, where are the tensions, though I believe that it is our value absolutely to create spaces that allow for young folks wholeness, for allowing, you know, young folks the agency and the space and time to identify the issues most important to them, and the solutions, right? Oftentimes the pace of what we're creating and the circumstances, the external circumstances don't allow for it. And so just want to invite you to read over, you know, some of the distinction between intent versus impact. We're beginning to kind of think about the challenges already to using the term at risk. And it's been quite beautiful that we've moved away from that, right? And that focus on the deficit. Though there is a value in naming the external conditions that are making it really hard for young people to actualize their fullest potential. And so what do you see in your particular roles as you're building out programming and as you're making efforts towards seeing young folks' wholeness and actualizing support, being partners with them and actualizing their promise? What do you see as some of the challenges to this work?
The story of their journey of doing this work over the past, I believe it's 3 years. Correct me if I'm wrong, Irene. And, as I mentioned, we really want to be able to spotlight each one of your programs so that we can more deeply see all of the beauty and the challenge that's there. So I'm going to, again, invite you to add to that document. I know some of you already have, so we can hear a little bit more. But I'm going to pass it to Irene because we really want to invite you into this space to help us see about your own journey as a county doing this work.
Yes, thank you, Amy. I know we're short on time, so I'll try to make it as informative as possible, but also not too long. So my name is Irene Dry. Like I mentioned earlier, I work alongside Denise Cavania, which is a senior director at the Higher Education and Adult Learning Department here at Imperial County Office of Education. And I'm just going to take a few minutes to share our story here at regarding our BHSSA journey in Imperial County and how it began. At the beginning, we learned really early on that it wasn't just about a program or a deliverable. It was about building relationships, especially because we are from a rural community. So when we first launched the BHSS grant, our goal was simple but very powerful. It was to build vital partnerships and partnerships between us, Imperial County Office of Education, and Imperial County Behavioral Health Services and our local school districts. So we recognized early that true collaboration would only happen if we build trust and understanding between the educational system and the behavioral health system. Two worlds that, as you know, usually interact and intersect, but they don't always align. And so one of our first things that we started doing is bringing everybody to the table to start and initiate those partnerships, because we know that that's where the collaboration and the communication and the alignment is where we needed to start with. So because of this initiative of building these partnerships early on, we were able to create the Imperial County School-Based Mental Health Consortium. The consortium was built, it included school districts, us, ICOE, and behavioral health. And in this consortium, we started with having defined rules, and everybody had a voting procedure, a structure, a framework, right? Because we didn't just want to it wasn't just a meeting for us. It was building a community. It was building a partnership. It was having everybody have a voice on the table. And so much so that we also created a logo, right? A mission statement, a framework for us to collaborate as a community, as a county, and make this more of a county-wide movement. And so, of course, building this foundation came with its own challenges, right? Because you're talking about different systems, you're talking about different infrastructures, our roles are different. The lens of education sometimes does not align with the lens of behavioral health, or they're coming from different avenues. So it wasn't easy when I say like we build a consortium, but I have to say and reiterate that the partnership and the trust and the collaboration was essential in order for us to build this foundation and to continue going on. And see the next. And this was a space for us to hear everybody's voice, which was super important for us. Once we build that foundation of this partnership and establish that, we move into, okay, how can we strengthen the work together? How can we not just make this a deliverable or a check mark? We wanted to formalize official partnerships in order for everybody to have accountability and that consistency and that shared ownership of the movement that we wanted to do in our community. And so for us, it was important that we created those MOUs with our districts, and each district had an assigned representative who would partner and attend these consortium meetings, and in order for us to move forward into how can we support our students. And in this MOUs, when I say the school districts, it's because we had mental health specialists at each of these school districts. And because of this, and I continue to say like these partnerships, bringing everybody on the table, the consortium built such close unity that we were able to create and expand, or actually create a school-based mental health professional network. And here's where you would see school counselors, psychologists, mental health specialists, administrators attend these networks. And it was a space for learning and for mutual support. And remember I said earlier, one of the things is like, how do you align education and behavioral health? Well, this was where the network, this is where the networks were super important, and for us to collaborate and start talking about, hey, what are you doing? How can we do work together? How can we sit at the same table and have a voice together? And through these networks, we were able to share each other's framework, share each other's language, right? We just learned that language is super important. And so this is where like we had education and behavioral health talk about the same goals in order through a different lens in order to support our students and in order to support our community. And so this is where we really started knowing and learning about each other, learning about behavioral health, sees it as a continuum, education sees it as a tier, and how can we collaborate together in order to support our students. And through these partnerships, I'm going to have to say it wasn't easy. It was everybody in the table. And sometimes we had disagreements of like which lens we were coming from, but these were essential. These were important because even about the difference between a screener and an assessment, right? Like who's responsible for that? What is that? Which partnership was going to take that role, et cetera. And here, where are we now, right? Like I got you through the beginning, the middle part. And so now where are we at with these partnerships that we have developed since the beginning? We have reached a moment where our systems and our relationships that we built early on have completely change the way we collaborate, because we're able to sustain. Because of these partnerships, we have been able to sustain the relationships. We have been able to sustain. For example, we currently have 13 active mental health specialists at the high school who are sustained through local district partnerships, no longer through BHSSA grants or funding, but through local district partnerships. And we wouldn't have been able to do that if it wasn't for, like I said early on, building that community. We also still have the consortium. We meet quarterly where we give each other a powerful platform where we share that alignment, that data sharing, that collective problem solving. And we also continue to have the school-based mental health network where the community comes together and we have that shared, the shared goal. And for us, we always say, like, if it wasn't for that early on collaboration, we wouldn't have been able to be where we're at, and we wouldn't have been able to still have our mental health specialists at the high school. Which is very unique to us for us because we're a rural community. one of our biggest strengths is working together, that relationship and partnership. But like I mentioned earlier, it was not easy getting everybody on the table. It was not easy having those uncomfortable conversations as well. But it was an important part of our growth and an important part of that we are able to now sustain. So for us, this journey doesn't end. It continues. We're no longer building from scratch, thankfully, but we're building from our strengths, and something that we're super proud of.
Thank you so much, Irene. Is there one thing, just as a reminder, is that Irene and her team are partnership development leads for the TCTs. And so if that is an area that you're trying to build with your work for Promise Youth, they are willing and able to really provide some on-the-ground support around, what they created, how that might apply to what where you're moving. So just keep that in mind.
Yes, there's just a further slide for you to request that support. Denise and I are more than welcome to even have these conversations one-on-one with you to offer that peer support. Because of course, I didn't give you all the details. And bringing people on the table, it is a challenge. And even seeing who to bring on the table is a challenge. But we can talk about even those MOUs and give templates, etc. So feel free to, in the next slides, request that if you would like. Thank you so much for this opportunity.
Thank you, Irene. I know that we always overestimate how much we're going to be able to fit into our session. So we're sorry that these last things we're kind of rushing through. We'll talk more about this, but we wanted to just give you a visual of this overlap of who you are, who are the At Promise grantees, and where does your work kind of fall in that Venn diagram. Lots of programs focusing on peer mentorship and leadership and student voice, and restorative justice and career readiness, family engagement, evidence-based practices. We want to help you to connect with others who might be doing similar kinds of work. And so one way is through this document that I'm going to also have Stephen put in the chat, which is basically the summaries of your programs as they were, as you initially envisioned them. But we know that things have changed once we start rolling out programs. And so we'd love for you to take a look at the grantee summary, find your county, and see if there's things that need to be updated. It might be that the folks that are leading this work have changed in that time, or that you have adapted what your program is going to look like. So we would love for you to help us have a really current compilation of all of the summaries of the work. And so in closing, as I did say, we're going to stick around for a little while if you want to talk more. Please sign up for the Peer Spotlight. It is a low lift. You don't have to do prep, but it's just about helping others to really understand your program more deeply and be in conversation. So I think that link is in the chat. And then our next session is coming up on the 10th, but certainly reach out for technical assistance or connection before then if you would like. We are also encouraging you to utilize the Grantee Hub. There are resources there already. If you want to find resources, if you want to share resources that have been helpful to you in your program, this is a great place to put them. Here is the QR code to request TA from the TCT leads, from STAC. There's some upcoming programming for you all to take advantage of if that is something that you can fit into your day, or team members. We're gonna, the two slides that come after this are about how to request TA and giving us some feedback to this session and what worked for you, what you'd like to see more of, what we can do to ensure that this community of practice really meets your needs. But we did want to close with a poem. And so I'm going to ask if there's someone in the room who is willing to read this poem out loud. Thank you. Yeah.
Did you hear about the rose that grew from a crack in the concrete? Proving nature's law is wrong It learned to walk without having feet. Funny it seems, but by keeping its dreams, it learned to breathe fresh air. Long live the rose that grew from concrete when no one else ever cared. By Tupac Shakur.
Yeah, thank you. That's